audience population was the teenage students in the USA. The definition of healthcare. Healthcare is the maintenance and improvement of physical and mental health, primarily via the medical services provision. Argument. Thesis statement. An argument by the nationals of countries is that healthcare should be provided by the government because it is state maintained to ensure citizen health is maintained. Examples of the healthcare by government. 1. The insurance policies offered by government. Insurance policies are legal and required to be offered by the government. The insurance policies covered includes all the citizens and the children under the age of 18 years who should be covered by their parents. 2. Drug administration. The administration of drugs by the government to its citizens should be priority as far as healthcare is considered. The drug administration includes the drugs of certain critical diseases like cancer, which can be subsidized or reduce the cost of the treatment for such a disease. Other conditions can be adequately treated and controlled by entire government efforts. 3. Screening and testing. The screening and testing of the disease would be done by the government. The tested conditions include HIV, AIDS, while the screened diseases includes cancer, among others. Critical diseases like HIV, AIDS, and cancer that reduce the workforce and the human labor for the country development. How the parents, guardians, and children enjoy the health care from the government. The parents should use the citizenship for identifications for the health care, while the children should use the parents' and guardians' identifications for their recognition. The citizenship should be used in the hospitals and the use of the insurance covers. Examples of diseases that require specializing care. Cancer is one of the diseases that require specialized care, where diagnosis is required for treatment or prevention. Cancer is only treated at the first stage, but in the advanced stages, the patient can only be helped by reducing the agony and suffering. Other conditions, like the kidneys, require the dialysis and their treatment, where the machines are costly for buy and maintaining, and therefore left slowly to the government. The candy transport also requires specialized critical care, which requires such high cost, and therefore the government should put its hand. The government should also buy, own, and maintain the VCT centers for prepare care, as well as URVs for the HIV and AIDS patients' care. An example of countries offering healthcare: USA and UK which have a full healthcare program for its citizens and permanent residents. It is a requirement and suggestion by the WHO that all countries owe a duty of care to the health of their citizens. Factors that should be considered in the health care provision. Environment. Number one is environment. The surrounding may have causative agents to viruses, diseases, and therefore considered for the healthcare provision. 2. Sanitation. The cleanliness and the better sanitation for the citizen should be left vital for the provision of the health care by the government. 3. Neighborhood. The government should ensure that all people in the countries and their neighborhoods are healthy to prevent diseases. Nutrition. Number 4 is nutrition. Eating healthy is critical, and therefore the government should ensure that better food the citizen is always vital. The citizen may not follow all the process of the manufacturing of food, but the government has the power. Counter argument. The another side of the argument is that the government has no reason or power to offer the health care to its citizens, but the responsibility should be left slowly for the citizen. Citizens is concerned with their lives by sanitation, environment, and nutrition, where the government should be left to have and only the development projects like constructions of hospitals, roads, and ensuring the food products sold are healthy for human consumption. Conclusion. All the government are entitled to citizen health care all the countries. The health care should start from insurance, environment, nutrition, sanitation, and neighborhood others, and leave the citizen only to be the workforce for the development project for the countries to grow economically, socially, and politically. Last quote. All the governments in the world will have a plan for the year 2030 for the health care of their citizen, where the citizen will only require to visit the hospital and pay nothing for the service.